Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Every year, 15 million babies are born prematurely, accounting for more than 1 in 10 of all babies around the world. Half of these babies born at or below 32 weeks or 2 months early die due to lack of feasible, cost-effective care, especially in low-income countries.
In Uganda, we score 28th on the world score in terms of high numbers of premature birth. So we are among those countries that have a very high rate of premature birth. And when you look at our premature birth rates, about 14 babies, in every 1,000 babies that are born in Uganda, 14 of them are preterm.
And in almost all countries with reliable data, preterm birth rates are increasing. But what could be the cause?
The commonest being having an infection that has not been treated or diagnosed, that would stimulate them to, that would stimulate labor to set in a bit early. Another reason, if the mother is having more than one baby in their womb, so the pressures that build up within their womb cause labor most of the time to set in early.
Things like fetal distress or anything that makes baby uncomfortable in the womb will eventually lead to that baby coming out prematurely. Now, there are other conditions, for example, incompatibility between the mother's immune system and the baby's immune system. You've heard of something called rhesus negative versus rhesus positive blood groups. Sometimes those may interfere with the baby's capacity to remain in the uterus.
Sometimes we deliver them early, even before labor sets in. For example, if a mother has a high blood pressure, very high blood pressure, that has not been well controlled and is likely to cause danger to the mother. So we weigh between the mother and the baby, and most of the time we choose to deliver the mother so that we save the mother's life. Sometimes when the mother gets just spontaneous bleeding, would call that antepartum hemorrhage.
When I look at the placenta-related issues, the placenta, which is the cord that basically attaches the uterus to the baby, may have some abnormalities. 1. 2, the placenta may actually attach at an area where it is not compatible for it to stay for the duration of the pregnancy. We call it placenta previa. And then 3, the placenta may abruptly detach from the womb itself.
I would encourage every mother to visit hospital as soon as you get to know that you're pregnant. Yes, some of the causes of prematurity are preventable and well known. So the good thing, before we used to have 4 antenatal visits during pregnancy, but of late WHO encourages mothers to visit hospital on a monthly basis.
However, more than 3/4 of premature babies can be saved with feasible and cost-effective care.
Provision of warmth to the baby, ensuring that these babies are initiated immediately on breastfeeding after birth, adequate education and information of the mothers to understand the preventable modes and mechanisms that can be done to ensure that they do not have premature babies, treatment of things like infection, both in the mother and in the baby, and eventually ensuring that if babies are born and they have, for example, difficulty in breathing, these conditions are dealt with to avoid any complications.
For example, expect them to get rickets if it's not prevented. So as progressively, as part of chronic care, we usually give them vitamin D supplementation. We expect them to get, in the long run, anemia, so we usually give them iron supplementation to prevent anemia. We help them in their brain development. We usually encourage parents to be part of care in terms of brain stimulation. We encourage them to talk to their babies, to sing to them. And then we also do kangaroo mother care. This helps to maintain body temperature for the babies. Actually, kangaroo mother care is better than the incubator warmth or temperature, because we set the incubator temperature at a constant figure, while the body temperature keeps varying with environment a bit. So the baby gets to get that natural warmth from the...
Babies born preterm are likely to suffer some congenital development complications if not well cared for.
Preterm birth may lead to cerebral palsy, which is really damage to the brain, mental retardation. It can lead to impaired learning. It can lead to vision problems, hearing problems, dental problems, behavioral problems, and psychological problems, and can also lead to chronic health issues.
A lot of these babies, especially if they are born before the last trimester, may not receive the transfer of certain nutrients, may not receive adequate transfer of certain nutrients that are key to their development. One of the key nutrients that these babies may not receive is actually iron. So you find once they're born, their iron stores may not be adequate. In the hospital setup, these babies are supplemented to ensure that they get the right nutrients. It's very important for us to educate our mothers and advise them on the kind of foods that they can supplement or complement their babies on to ensure that they receive the right nutrients.
The Ministry of Health says it is training more health workers in neonatal care, among other interventions targeting the reduction of neonatal deaths.
And so far we have mentored about 152 health workers in the West Nile region alone on infection prevention, newborn resuscitation, caring for the sick newborn and small babies, and essential newborn care and advanced resuscitation. The Ministry of Health with partners has been able to set up a state-of-art neonatal intensive care unit at Kawempe National Referral Hospital, which is equipped with advanced newborn care machines, and our plans are underway to roll these units, all units in the Kampala Capital City Authority, and all those facilities surrounding Kampala.
More than 60% of preterm births occur in Africa and South Asia. But preterm birth is truly a global problem. In the lower income countries, on average, 12% of babies are born too early compared with 9% in higher income countries. Within countries, poorer families are at higher risk. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.